Good day, my name is Sheila May Awak-Staro from the University of the Visayas, Min, Bachelor of Science in Nursing 1. So for today's video, I'm going to demonstrate the health assessment, which is the examination of the mouth and nose. So first is, inspect and palpate the external part of the patient's nose. It should be fairly symmetrical, no lesions, deformities, or deviation. Ask the patient to include one nostril as he inhale and exhale. Can you put your finger on your side? Air should flow freely in and out of the other nostril. Inhale, exhale. Inhale, exhale. Okay, thank you. Down. Next is inspect the nasal cavity using an otoscope with a short, wide tape speculum. So, you should see coarse hairs leaving the anterior surface and isolated membrane lining the posterior surface. And the mucosa should be pink and moist. Lesions, drainage, or obstructions should not be observed. Next is inspect the nasal septum and note any deviations, inflammations, or perforations. Inspect the turbinates. They should be light red without swelling, exudate, tenderness, and polyps. Next is ask the patient to bite down and bare his teeth. In front of the mouth, his, his upper teeth should override the lower teeth slightly. Okay, sir, can you bite your lower part of your mouth? And then bare your teeth. Okay, thank you. Inspect the patient's lips. They should be moist with normal color, ulcer cracking, or scaliness. The next is ask the patient to close her mouth. The lips should close hermetically. Palpate the lips. It should feel soft and smooth. Document normal findings. Next is assess the oral mucosa using the tongue, belt, and light source. Normally, it is the pink, smooth and moist, no lesions or nodules. The dark-skinned patient, you will commonly see increased mucosal pigmentation. So now, I'm going to demonstrate. So next is assess the patient's teeth and gums. Normally, adults have 32 evenly shaped, ivory-colored teeth. Next is inspect the oral cavity. The hard palate should be bony and white. The soft palate should be muscular and pink. The vola should be pink, midline, and free of lesions. Next is inspect the tongue. The dorsal surface should be symmetric and softly rough. Then, the ventral surface should be soft and pink. Hold the patient's tongue by the using of gauze pad and palpate the floor of the mouth. You should not feel palms or interactions. So next is ask the patient to stick out his tongue. It should be midline and free of tremors. Next is place the tongue blade at the side of the tongue and ask him to push it away. Tongue pressure should be equal on both sides. This tests the hypoglossal nerve. Sir, can you open your mouth? Push it back. And right. Push it back. Okay. Check the glossopharyngeal and vagus nerves that is pressing the tongue and have the patient says ah. The soft palate should raise symmetrical and the uvula should stay in the midline position. Next is instruct the patient say ah again and assist the parents and cut tonsils. The mucosa should be smooth and pink. Say ah. Rate the tonsil size on the skull from +1 if the tonsils are available, +4 if they touch each other. That's all for the examination of the mouth and nose.